So those who weren't at Hanita, we had a lot of fun at Hanita. And we had a great day showing a little bit about the factory, talking a little bit in more depth about our product. Some of them was also a few slides that will be presented here. And the lens that I will present is a multifocal lens, a presbyopia correcting lens, which is available in these two models. One is a 4-loop lens, the other one is a C-loop lens. The lens itself is made from hydrophilic material. And the reason that we are been calling it now a full-range lens, and this is a lens that has been in the market for a few years, we made extensive tests to the lens along with a few key opinion leaders with which we are working with. And it seems that we have established, and we are now in a position to say that we have a full-range functional vision lens. And this is its defocus curve, a defocus curve which has been derived by correcting the patient for his best corrected visual acuity, and then adding the additional lenses in order to see the visual acuity of that patient. If we'll compare, and this is a slide that was made by a surgeon in the Netherlands, Dr. Lapid, who took into account other measurements for trifocal lenses. And there you can see that the lens which is here, the full-range lens, which is expressed in red, you can see its benefits, both for far and for the near vision. You're at 40 centimeters, you get more than 6/6 vision, better than logmar 0. And here in the intermediate vision, okay, if we would look at this area, this is the crossing area from which the lens operates a little bit less than the trifocal lenses, which is at around 1 meter. But then again, at 1 meter, you usually look at large elements, and this is why this lens eventually, with its quality of life, and we'll get that back to that at the end, operates wonderfully. As a class noted before, visual acuity is not the only thing, and we knew that while we were developing this lens a few years ago. We placed a lot of emphasis on the accuracy of the lens manufacture in order to be copy exactly to the lens that was designed through a very advanced eye model, the Arizona eye model, that takes into account both chromatic aberrations and spherical aberrations as well. And this is the diffractive optics that we have eventually derived. And one of the things we placed a lot of emphasis on this lens is not that it's only hydrophilic lens that doesn't have any vacuoles or any element that will eventually obscure the image with the lens, is the fact that we would have these edges of the diffractive steps to be very, very accurate, precise, and sharp. When you get those sharp edges, you get less stray light, you'll get better contrast sensitivity. But how much? Well, we got there and measured. And this is from a study that was performed by Professor Jorge Alio. And in this case, you see the full-range lens in red, and in blue, the monofocal group. And here the measurements are both for photopic vision and scotopic vision. And you can see that in both cases, the lens contrast sensitivity eventually performs as if it is a monofocal lens. Many surgeons around the world are not using multifocal lenses because they are afraid or concerned about the reduced contrast sensitivity. And this is sometimes a presbyopic patient complaints after a multifocal lens that has been implanted. Not in this case, as the lens eventually performs in its contrast sensitivity. Similarly, we made additional study along with Tom Vandenberg team who took results from various lenses that are available, multifocal lenses that are available around the world. And here you can see the result of the C lens in this case. This is the C lens multifocal full range lens. Here you will be able to see the age of the group that was tested, and this is the stray light in log. It's just exactly as in logmar. The higher it is, you have more stray light. Okay, 2 means 100% of stray light, and this line represents the phakic norm. Eventually, when a lens is being implanted, okay, if you're below that line, the lower you are below that line, you got less stray light from the norm, okay, and if you're above the line, you get higher stray light with that lens. And here you can see that in our group, we are the lowest run from that line, which eventually represents that this is the lowest stray light lens that was ever measured, at least known to us, as it was concluded from this meta-analysis that was gathered. So we predicted that this quality of life, the quality of life with that lens would be improved. An added value of our lens is, again, the manufacturing process that we have implemented. And this manufacturing process that was implemented, as I said, we took into account to have the diffractive steps as sharp as possible. Having the diffractive steps as sharp as possible eventually led to having the square edge very, very sharp. And this is a measurement that was made by Professor Manfred Tetz's team, who measured other lenses that are there in the market. The measurement was the area that is encapsulated in the triangle around the square edge. The smaller the triangle, the smaller the area, the sharper the edge. And eventually our lens outperformed all the others by at least 70%. But the outcome of that eventually should be measured by the Yakir capsulotomy rate, which after 5 years represented 2.2% of Yakir capsulotomy, and that is for a diffractive multifocal lens. Usually those lenses are more susceptible to any opacities that occur in the posterior capsule. But the YAG rate in this lens were significantly lower than the ones that others that are known in the market, whether they are hydrophilic, whether they are hydrophobic. This was also been made was tested in another site in Colombia from a scale of 200 lenses. After 5 years, only 10 lenses had Yakir capsulotomies. After 2 years, none did. But as we all are looking for the best quality of life for for the patients, this is a quality of life questionnaire that was made by 6 months, 2 years, 3 years, and 5 years after the operation. And as you can see, the patients can read small print, can see steps or make sports activities, cooking, which is a very intermediate activity. There's no problem doing that. Watch TV. Driving during the day is very low. Driving at night is also below 1. And here the scales are that when we're talking about 1, then it's a very mild mild difficulty. Oh, I'm pressing the wrong button over there. Okay, a very, very mild difficulty to perform the activity. So just to conclude, we have a very low YAG rate lens with the lowest measured stray light, with a functional intermediate vision, and it's a full range lens. Now, as part of what we have discussed before, and the people that visited us, and Jerome has raised his hand that he will support that. We would love to have a Presbymania group study, full range group study about this lens. Each could get 6 IOLs to his hands, perform a 3 months follow-up that would include measurements of the visual acuity for the different distances, quality of life questionnaire, a defocus curve to be derived, and if possible, if you have a Pelly-Robson or other tool to measure the contrast sensitivity, you're more than welcome to do that. Thank you very much. everybody.